The private duty nursing community is such a small community that we tend to hire a lot of nurses who have worked for our competitors. I've been in patients' home where we're sharing the patient with our competitors, so the other agency's nurse is in the home while I'm admitting the same patient to our services. And inevitably these nurses will say, "Are you documenting this admission on your cell phone?" And I'm like, "Yeah, I am." They're like, "Can I take a peek at that?" And I'm like, "Absolutely." We are in the pediatric private duty nursing, so a lot of Medicaid business, and we get into a lot of secondary claims. Private duty nursing, I think, is a very underserved population, very underserved community of patients. There's not enough providers to go around. I have been in private duty nursing, pediatric private duty nursing, for almost the entirety of my nursing career. I did 1 year in the hospital and then went right into pediatric home health services. AlayaCare is a powerhouse. I just feel like the platform is so versatile that we can make whatever it is that we need. It's been a great recruitment tool for us, actually, because I think the nurses kind of see that there's better options out there for them. The custom forms builder was definitely one thing that stuck out, that I was really surprised to see that a lot of other providers didn't have that. Clinical forms and the care plans are two really big areas where, as the franchisor, we are able to set really good templates of these things and then just sort of push them down to the different states to use, and further make state-specific variations of these things based on the regulations.
The advances even on how we've been submitting our electronic claims and everything. Originally with the visit approval and everything, like I was coming into the office every morning and literally just bringing up the schedule and going through it and checking each visit, one by one. And the implementation of the visit verification has, of course, alleviated a lot of that and really reduced the amount of visits that are being flagged for something that's inconsistent. And when we generate those claims, it's just so, everything's just so in place already to know this is how these claims need to look. So by the time we send them to our third party, they're just ready to go. Just the financial reporting capabilities in there is just so great that we're going to be able to see exactly how every location's doing just based on these reports that we've been working hard to create over the last few months. And we're developing more and more.
We're going to be able to really better support our franchises no matter what state they pop up in. Since signing with AlayaCare, I've been blown away by literally every single person at AlayaCare whose path that I have crossed and who I've met and had a conversation with. Every single one of them has been incredibly invested in our story, our growth, our success. No matter what state, no matter what rules, regulations, payers, EVV requirements, AlayaCare is so versatile that we're going to be able to use that system to achieve whatever it is that we're trying to achieve. It's going to grow alongside with us as we grow.